So, hi students, today we'll be discussing all your A to Z updates 2023. The PDF has been given to you on Instagram page. So, you can follow me on Instagram and you can get the links for the PDF. So, this video is just a rapid glance of all the topics which has been arranged in alphabet mode, So, just a rapid glance. I don't want to take much of your time during your exams. So within around 60 minutes, I'll be finishing this session. All the important updates which are very important for your exams. So first is Antara. Antara is an injectable contraceptive, progesterone based contraceptive, which is DMPA. And it is given intramuscular route every 3 months once. And it is also suitable for breastfeeding women. This will be the question whether it is suitable or not. Amrit, one more new important thing, like they are providing affordable medicines and reliable implants for treatment. This is the full form. It is a pharmacy store in most of the AIMS hospitals giving cancer, cardiovascular drugs, and cardiac implants at an affordable price. So it is for CCC, cancer, cardiovascular drugs, and cardiac implants at an affordable price. What is A again? Akshaya TB free initiative. Akshaya means I don't want tuberculosis. I want to eliminate this. This is a initiative funded by Global Fund to fight three diseases: ATM, AIDS, TB, and malaria, and it is mainly targeting underserved communities like urban slums, tribal areas where they want to target this disease, tuberculosis. Ayushman Bharat under Ministry of Health and Family Welfare has two components. One is Health and Wellness Center, the second is Pradhan Mantri Jan Arogya Yojana. All the sub-centers and primary health centers will become health and wellness centers, covering not just the allopathic part, and even the Ayush part will also be covered, where they will be posting Ayush medical officer, giving comprehensive primary health care, bringing all the modalities into treatment, where it will cover preventive, promotive, even curative part along with rehabilitation part also. What is Pradhan Mantri Jan Arogya Yojana? One of the components of Ayushman Bharat scheme. Here what they are giving, it is giving health insurance. This scheme is giving health insurance up to 5 lakh per family per year. Remember this number, it is up to 5 lakh per family per year, not per family member, it is per family. So it is under Ministry of Health and Family Welfare. There is no restriction of family size and age of family members. Very important point. And it can be availed in throughout the country, anywhere, like all the government hospitals are involved and selected private hospitals. You will get a card and it is for health insurance, not for primary care, it is for secondary and tertiary care. So it is portable within the country. Atal Bimit Vyakti Kalyan Yojana, it is under ESI. It is unemployment allowance. If there is unemployment due to closure of factories, this is giving unemployment relief, unemployment allowance up to 90 days, once in a lifetime. So it is under which scheme? It is under ESI, Atal Bimit Vyakti Kalyan Yojana. Coming to AIDS, very important thing you should know is, what is ERT? Used now for treatment, it is TLD, fixed dose combination of tenofovir, lamivudine, and dolutegravir. As you can see the tablets there, before TLE was used, now it is TLD. Start treatment irrespective of CD4 count and clinical staging. That means it is test and treat policy. As soon as you diagnose, we have to start treatment. Prevention of parent to child transmission, where pregnant will get TLD now, and newborn, if the mother is on ART, we give nevirapine, minimum duration 6 weeks, maximum duration 18 months. But if the mother was not on ART, high risk infant, we have to give nevirapine plus zidovudine. Two drugs are important if the infant is high risk, and we have to start cotrimoxazole prophylaxis from 6 weeks, after ruling out HIV at 6 weeks, early infant diagnosis at 6 weeks. Then post exposure prophylaxis, where we use TLD in India, 4 weeks duration if there is any exposure to HIV. But WHO says The best regimen is TED, where the second drug is important, it is emtricitabine. But if the question mentioned which is the best, according to WHO, then your answer will be TED combination, TED. But if they don't mention anything, according to our Indian condition, if they ask, it is TLD. TLD for post-exposure prophylaxis also. It becomes simple: adult TRT, TLD, pregnant TLD, post-exposure prophylaxis TLD in India. Tenofovir, lamivudine and dolutegravir. Anemia Mukt Bharat, you should know it is nothing but intensified National Iron Plus initiative to reduce anemia. The age groups will be covered with iron folic acid tablets. 6 months to 5 years, we are giving bi-weekly 1 ml syrup. The dose of 1 ml will be having 20 mg elemental iron, 100 microgram folic acid. Then 5 to 9 years, pink tablet weekly once, the dose 45 400. Then come to adolescent, very important, weekly once the tablet, blue color, the dose 60 500, blue color tablet. Before it was 100, now it is 60. Good. Then pregnant and lactating women, we are giving daily iron folic acid, red color tablet with a dose of 60 500, starting from second trimester till delivery. Then after delivery also, it is 6 months, 6 months. Post delivery also we are giving supplementation every day. Important. Reproductive women, weekly once, red color tablet. So it is red tablet for both pregnant and reproductive women. Pregnant it is daily, reproductive women iron folic acid, I am telling, it is red color tablet weekly once. Blindness related, come to alphabet B. The program what we have is not just national program for controlling blindness, it is and visual impairment. It has been labeled like NPCD and VI, and visual impairment. The definition of blindness, visual acuity cutoff, like WHO we are following now, it is less than 3 by 60. Prevalence of blindness as of now it is 0.36%, but the target is very important. 0.25% by 2025. Remember the number 2525. 0.25% by the year 2025. And what was GET 2020 related to? It is related to trachoma, where the whole world has to be free of trachoma. That was the target given by WHO, to eliminate trachoma by the year 2020, and India has achieved that target. We have achieved that target also. What is the alphabet C? Denotes important updates. Chaya centproman, C for Chaya, C for centproman. The chemical is or meloxifene. Saheli was used before, now it is Chaya. Non-steroidal OCPs. For the initial 3 months it is twice a week. After 3 months it is once a week. What is CoWIN related to? CoWIN is a website or an application for COVID related stuffs like COVID vaccine intelligence network. It is registering the beneficiaries for vaccines, and you can even download the vaccination certificates, get your vaccination done. D for Dakshata, very important, training doctors and nurses for delivery practices, intrapartum care and immediate postpartum care. It is like D for Dakshata, D for delivery practices, to reduce maternal mortality, the complications during delivery, how to manage it. Even is only for other vaccines, like COVID is for COVID vaccines, even is for other vaccines, where you enter the data, like cold chain handlers will be entering the data into the application. How many vaccines used, how many left, we will be entering the inventory stocks also. At the same time, cold chain temperature. It is like digitalizing the vaccine stock inventory and cold chain temperature. Everything is in the app, and the access will be very easy for us. Last, like we used to keep some data in the books, now it has become soft copies. Everything is entered into the application. What is even? Data entry done by cold chain handlers at primary health center, because the last storage point is primary health center. The data is entered into even application related to vaccine. ESI, Employment State Insurance Act, the ministry what is coming under, it is under Ministry of Labor and Employment. The premium part is very important. The total 4% of the wages will be paid as premium to the company. 3.25% is by the boss, and the worker will pay 0.75%. So total it is 4%. Important. And the benefits what ESA is giving. Sickness benefit 70%, 91 days. Extended sickness for chronic diseases 80%, 2 years. Remember 10% extra, 2 years covering 34 diseases. Sterilization, we give enhanced sickness benefit. Remember the word enhanced sickness benefit, 7 days, 14 days. 7 days for male, 14 days for female. Full wage. Pregnancy benefit, maternity benefit is full wage, 26 weeks. Important, 26 week. After injury, it is disablement benefit, 90%. Either it is temporary disablement or permanent disablement, like loss of foot, loss of hand during work. After death, there will be two things. One is the dependents will get monthly pension, 90% of the wages, and funeral expenses is increased to 15,000. It has been increased now to 15,000. What is I strategy? One more from the alphabet E. Eliminate yellow fever epidemics. See the full form. It is eliminating yellow fever epidemics. WHO strategy, where WHO is targeting mainly this disease, yellow fever, targeting African countries where yellow fever is endemic. Protecting at-risk population, one, by giving proper vaccines. International spread, we have to limit by taking care of those vaccination certificates and containing the epidemics rapidly. In that African countries, they want to target this vector Aedes, which can transmit yellow fever. Facility based newborn care, from the alphabet F, very important. This is related to hospitals. What hospitals should have the units, what is taking care at the hospital level. Like we have 1, 2, 3. Repeat, 1, 2, 3. Special newborn care unit is at district or sub-district hospitals with 12 beds, managing low birth weight infants with weight less than 1.8 kg. Remember, less than 1.8 kg. Newborn stabilization units at CHC level or first referral unit with 4 to 6 beds. Managing low birth weight infants with weight more than 1.8 kg with no other complications. If there is complication, we will refer to the higher center. Phototherapy is available, and we have to manage sepsis. We have to manage sepsis, remember. And if there is a labor room or operation theaters where cesarean will be done, we need at least one bedded unit, that is newborn care corner, to take care of the newborn with warmers, suction machines, umbu bag and oxygen. Basic newborn care is given. Basic care at birth is given related to hypothermia, infection, warmth, breastfeeding, etc. If there is any newborn who is sick, refer to higher center. Refer to higher center. This is facility-based newborn care. Facility-based newborn care. What is free days? As you can see there, it is under menstrual hygiene scheme, sanitary pads for rural adolescents, not urban. It is rural adolescents to promote menstrual hygiene. It is given under the brand name Free Days. Under the brand name Free Days. Filariasis elimination strategy is very, very important. We are targeting filariasis for elimination. The mnemonic is make my trip. Make my trip. Good. And the words what I am telling is in sequence. First, we have to do mapping by checking the antigenicity in that area by using ICT, immunochromatographic test, and the prevalence is more than 1%. We tell that the area is endemic. Yes, this area is endemic. Start mass drug administration in that locality only using 3 drugs: ivermectin, DEC, albendazole. Triple drug therapy is used to eliminate filariasis. Once a year we are doing, annually, for continuous 5 years. How many years? 5 years. Covering 85% of the eligible population. Pregnancy is a contraindication. Remember this. After 5 years of mass drug administration, we check the level of infection, whether it is below the threshold level or not. That is called as transmission assessment survey. After 5 years of MDA, if it is below the threshold level, we are stopping mass drug administration. Repeat the mnemonic: Make my trip, MMT. Mapping is done before MDA. After MDA, we do transmission assessment survey. Before starting MDA, we are doing mapping. Before stopping MDA, we are doing transmission assessment survey. What are the drugs used for MDA? Repeat with me. IDA. Ivermectin, DEC, albendazole. Ivermectin, DEC, albendazole. Very good. Come to the alphabet G. Targets you have to remember. It's been repeated in the exam. Global Action Plan for Targeting Pneumonia and Diarrhea. It is for the whole world what WHO is giving that target. It is targeting mainly under 5 years. Under 5 years, the targets has to be achieved by 2025. Remember the number 2025. The baseline year is taken as 2010. The baseline year will be 2010. What are the targets? Pneumonia and diarrhea. One is deaths. From pneumonia should be less than 3. From diarrhea should be less than 1. Obviously, pneumonia deaths, we can't keep it less than 1. It's difficult. Pneumonia less than 3, diarrhea less than 1 per 1000 live births. Incidence, both it is same, 75% of the incidence of both pneumonia and diarrhea has to be reduced. And stunting by 40%. Stunting by 40%. Remember the deaths, which is important. Repeatedly asked in the exam. Highlight that part. Less than 3, less than 1. Global hunger index from the alphabet G, what we are discussing, very very important. 3 dimension 4 indicator. 3 dimension 4 indicators. What are the dimensions? Inadequate food supply, then child mortality and child undernutrition. Within child undernutrition, there are 2 indicators. Under 5 wasting, that is acute malnourishment. Under 5 stunting, indicating chronic malnourishment. When you take global hunger index, all 3 dimensions are given equal 1/3 importance. Equal 1/3 importance. And the indicators part, under 5, like under nourished population, 1/3. This is 1 by 6, 1 by 6. When you add, it is 1 by 3, and it is again 1 by 3. यहाँ पे trick है देखो, यहाँ पे 1 by 6, 1 by 6. When you add together, it is 1 by 3. This is very very important. This is very very important to know. When you take the average, global hunger index ranges from 0 to 100. The value of our country is 29.1. 29.1 indicates serious hunger. As you can see in the image, 29.1 indicates serious hunger. When it is classified, is it necessary to remember the classification? No. India, yes, it is important. How much is the value? 29.1. Coming under moderate hunger? No, it is coming under serious hunger. It is under serious hunger. Good. Next, it is home-based newborn care, where ASHA worker is giving postnatal visits after the delivery to identify the danger signs and to reduce neonatal mortality rate. The number of visits what ASHA will be giving, it is in descending order. 7, 6, 5. 7 for home delivery, 6 for hospital vaginal delivery, and 5 for hospital cesarean section. And the incentive what ASHA will be getting is 250 rupees per child. It is 250 per child under home based newborn care. Home based care of young child, again ASHA will be giving home visits to counsel the mother regarding nutrition, breastfeeding and complementary feeding, where total 5 visits are given by ASHA worker. Again the incentive is 250 rupees per child. Indian Newborn Action Plan target, you should know, it is single digit neonatal mortality rate and stillbirth rate by the year 2030, where states should achieve this target individually. Some states will be given extra time by the year 2035, because the national level target we can achieve by 2030, but the states should achieve this target by 2035. I for Indradhanush. Mission Indradhanush is related to vaccination schedule. We target 12 vaccine preventable diseases: tuberculosis, BCG, diphtheria, pertussis, tetanus. TB means childhood tuberculosis. Diphtheria, pertussis, tetanus, DPT, polio, yes, measles, rubella, hepatitis B, Japanese encephalitis, rota, pneumonia, and meningitis due to hip. So total 12 diseases, 3, 5, 7, 8, 9, 10, 12 diseases. So hip is a part of pentavalent vaccine. So pentavalent vaccine we have in the schedule. So what is the schedule? Just a rapid glance at the schedule, what you know already: birth, BCG, OPV and hepatitis B. OPV 1, 2, 3 at 6, 10, 14 weeks. Pentavalent 1, 2, 3 at 6, 10, 14 weeks. Rota 1, 2, 3 at 6, 10, 14 weeks in selected states. IPV 1 and IPV 2 at 6 and 14 weeks. IPV at ninth month, this is the new addition, third dose at ninth month. PCV 1 and 2 at 6 and 14 weeks and booster. So Rota, IPV, PCV is used only in selected states. Rota, IPV, PCV, rest in peace. Rota, IPV, PCV. Ninth month, some states they use measles, some states they have shifted to MR first dose. Most of the states they have shifted to MR, measles and rubella. Vitamin A along with that Japanese encephalitis first dose, endemic states. 16 to 24 month it is booster, OPV and DPT. MR second dose, Japanese encephalitis second dose in endemic areas. 5 to 6 years we have DPT second booster, important. What we have in adolescent, it is TD1, TD2. 10 years, 16 years. Pregnancy, 2 doses of TD at a gap of 4 weeks. If the pregnancy happens within 3 years, if the pregnant was vaccinated before, she has to take booster. Highlight the year, it is 3 years, not 5 years, it is 3 years. One more Indradhanush, don't confuse. Mission Indradhanush is for vaccine. Abhiyan Indradhanush is under ESI hospitals, changing the bed sheets every day in the pattern of rainbow. Indradhanush is rainbow, you know that. So it is Vib Gyar, Vib, V for violet starts from Sunday. That won't be asked in the exam. Match the following Vib Gyar with the days, that won't be asked. But still, if you know what is Indradhanush, the purpose of Abhiyan Indradhanush is to promote sanitation. Like today, if I go and see the color of the bed sheet, I'll come to know what is today. Like Monday, if it is today, it is indigo color. We have to be like changing the bed sheets in ASA hospital. Integrated child development scheme. See the logo, Ministry of Women and Child Development, important. Anganwadi centers will be the nodal point of delivery of services. Number of Anganwadi centers you should know. Urban and rural area for 400 to 800 population. Tribal areas important, 300 to 800. The services given by Anganwadi center, supplementary nutrition, very important. Health checkup, immunization done by ANMs, not Anganwadi worker. Non-formal preschool education in the age 3 to 6 years, and health education and referral services if needed. Nutrition part is very important. See the table. Child, pregnant, severely malnourished child. Remember, like this in ascending order. 500, 600, 800 will be the calories to be given by Anganwadi center. Protein, remember the upper limit, 15, 20, 25. 15, 20, 25. If they ask for severely malnourished child, you should know the amount of calories and proteins to be given under Anganwadi center. This is one more initiative, Inspire initiative to end violence against children. What is Inspire? I for implementation of laws. I for implementation of laws, and for norms and values in the society, important. Yes, safe environment to be created. Parent support is must, and we have to reduce violence among children. I for income levels, if it is increasing, obviously it will end the violence among children, understood. Response to be given and support services should be there. Along with that, proper education will always end violence among children. INSPIRE. Even if you cannot remember what is the full form of Inspire, at least you should know what is Inspire related to, whether it is related to children, mother, schools, like that. It is to end violence against children. End violence against children. Janani Suraksha Yojana, where you give incentives to promote hospital delivery to reduce MMR. Incentives will be given to ASHA worker and also pregnant. Depending on the states, you should know low performing state, high performing state. Depending on the number of hospital delivery, low performing state UP Uttarakhand together, MP Chhattisgarh together, Bihar Jharkhand together. Like these two states were together. Now it is separate. Total 6 हो गया. 2 then 4. ROJA Roja is the mnemonic. Rajasthan, Odisha, Jammu and Assam. The remaining state will be high performing state. Why I am telling this? Because the eligibility and cash will be different. That is why. Low performing state, everyone is given incentive, all the pregnants. High performing state, either BPL certificate or SCST certificate, then only there is cash incentives. Delivery, hospital delivery, this is the table. How much ASHA is getting in rural area is important, 600. Urban area 400. Remember the incentives for ASHA, always rural area incentives will be more. So the mother in rural area LPS 1400, that is the highest incentive, low performing state and the rural area. We have to promote the delivery rate. Home delivery 500 for below poverty line pregnants, nothing for ASHA worker. आशा को कुछ नहीं मिलेगा, आशा काली हाथ if it is home delivery. जननी शिशु सुरक्षा कार्यक्रम, JSY is cash, incentives are direct to the account. JSSK is not related to incentives, it is giving free services to pregnant and sick infant. Highlight the word infant. Diet, drugs, diagnostic facility, transport facility, hospital to home, again drawback, in between facility, in between hospitals it is free. Caesarean section, we discussed in the class the mnemonic DTC, Delhi Transport Corporation. Along with that, blood and exemption from user charges, nothing to be paid for any of the services in the hospital. So JSY is giving cash incentives and JSSK is giving free services. Don't make mistake in between these two. Kala Azar we target for elimination. So question will be on Kala Azar, important. How to diagnose? Rapid diagnostic kit. Any suspect, take a drop of blood. RK39 is rapid diagnostic kit. Start treatment, drug of choice, liposomal amphotericin B. Endemic areas, go for Kala Azar fortnight, active search of cases, staying there for 15 days. It is done once in 3 months. That is quarterly search of cases. Sand fly is the vector. For controlling sand fly, we are using synthetic pyrethroids. Remember the alphabet S for sand fly, S for synthetic pyrethroids, preferred over DDT. It has been like shown some resistance to DDT, so we are using synthetic pyrethroids. Kilkari, vaccine related, like it is mainly audio messages. It is a mobile based application related to pregnancy care starting from second trimester, and the child will reach 1 year. Till then the messages will be stored and it will be given related to pregnancy and child care. For child it is till 1 year, mainly for vaccination stuffs. Kayakalp is promoting sanitation in government hospitals, public health facilities. Kayakalp awards will also be given, cash incentives based on the quality criteria. Quality assessment, now it is 7, not 6. Hospital upkeep, sanitation, waste management, infection control, support services, hygiene promotion. One thing which has been added now is beyond the hospital boundaries. So these are the parameters in which the quality of an hospital is assessed. So this will be the question. First the internal team will take care of that assessment, then the external team will come and cross check. The report will go to the higher units, their ranking will be given and cash incentives will be given. What is Lakshya scheme? Labor room quality. See how the labor room looks. Put one smiley to this. If it is like this, it's become very easy for us and easy and enthusiastic for us to work in such labor rooms. It is quality of labor rooms and hospital, like in the hospital OTs also. It is starting from CHCs, not in primary health center. That can be one trick. Lakshya is implemented from primary health centers, false statement. From community health center and above. Leprosy, very important skin topic, dermatology also. What we are doing the treatment part now. First initially it is same for both POSI and multi. The duration is different, 6 months, 12 months. The drugs will be same. Day 1 the patient will be getting rifampicin, clofazimine and dapsone supervision. The remaining days the patient will get dapsone and clofazimine. Like this, 1 pack is sufficient for 1 month, 6 packs for POSI, 12 packs for multi. So it is like this, RCD by CD 6 by 12. RCD by CD 6 by 12. Day 1 RCD, remaining days CD, 6 months, 12 months. Chemoprophylaxis for contacts, single dose rifampicin for close contacts. Sparsh campaign is to create awareness for leprosy in the community. The mascot what we are using, the poster will be Sapna Sapna is the mascot in Sparsh campaign for creating awareness among community related to leprosy. Leprosy case detection campaign is active case detection in high prevalence districts. Focused leprosy campaign. This is one new initiative where we are targeting areas with more number of child cases and cases with disabilities. There we are focusing more. The prevalence rate of leprosy now it is 0.45 per 10,000. If the prevalence is less than 1 per 10,000, we say leprosy has been eliminated, not a public health problem that has been achieved at national level. See this number, we have achieved at national level long back, but some districts around Chhattisgarh, the other Nagar Haveli will be having prevalence more than one. That is what I want to stress. This target has been achieved at national level, not at district level. Annual new case detection rate, which is the impact indicator of the program, it is around 5.52 per 1 lakh. Sir, whether I need to remember this, remember prevalence. Even if you forget incidence rate, remember prevalence rate. Incentive for reconstructive surgeries has been increased to 12,000 rupees. So malaria, how can I forget the alphabet M, malaria, drug policy, very easy question but repeated question. Treatment part, falciparum, ACT for 3 days, primaquine 1 dose. Very important. ACT for northeast states, artemether, lumefantrine. ACT for other states, artesunate SP. The second drug what we are using in the combination will be long-acting antimalarial. Highlight the long-acting antimalarials used in ACT, artemisinin derivative combination therapy. Vivax we are using chloroquine for 3 days, primaquine for 14 days to prevent relapse. Primaquine 1 dose in falciparum to prevent recrudescence, but here 2 weeks of primaquine to prevent hypnozoids in the liver, that is relapse. Mixed infection, make a mocktail of it. ACT for 3 days, primaquine for 14 days. Repeat, ACT for 3 days, primaquine for 14 days. Oval, same as Vivax. Malaria treatment is same as falciparum. We are using ACT. Pregnancy, always keep in mind, first trimester falciparum we are using quinine. Don't make mistake. For the other trimesters we can use ACT. Vivax, chloroquine is sufficient. Primaquine is contraindicated. Highlight this part. Primaquine is contraindicated in pregnancy. Now come to chemoprophylaxis in pregnancy depending on the duration of stay. If I am going and staying in a falciparum endemic area for up to 6 weeks, doxycycline is sufficient. More than 6 weeks, long-acting drug, mefloquine. If any contraindication, chloroquine. Like if I am saying mefloquine is contraindicated in convulsions, cardiac condition, what is the next drug to be used? C for chloroquine. Repeat the mnemonic DMC, designated microscopy center. Doxycycline, mefloquine and chloroquine. What is mother's absolute affection? To promote breastfeeding. This is related to breastfeeding. What is MCTS? Mother and child tracking system, where the pregnant, once she is coming to the antenatal clinic, she will be given one number, unique identity number, which will be generated from this system, that is used to track the mother whether she is getting antenatal care or postnatal care. And we also track the child for vaccination purpose. This is mother and child tracking system. Mission Parivar Vikas related to family planning, where we need to achieve this level of total fertility rate 2.1. All over the country the average has been achieved, but in certain districts still they are having total fertility rate of 3 and more. In such districts we are promoting this campaign. We are giving more and more contraceptives to make it 2.1 by 2025. Antara I have discussed, Chai I have discussed, and progesterone only pills. These things being promoted under Mission Parivar Vikas, that is related to family planning. Monica project, repeat question. It is monitoring the trends and determinants related to which disease? Cardiovascular disease. CA, the last two letters denotes cardiovascular disease. WHO project for monitoring the trends and determinants of cardiovascular diseases. Midday meal scheme has been renamed now. We don't get this name midday meal now. It is like Pradhan Mantri Poshan or Pradhan Mantri Poshan Shakti Nirman. In the school children, we are providing midday meals. What ministry now? It is under Ministry of Education. Previously, it was known as Ministry of Human Resource Development. The name has been changed to Ministry of Education. Remember the calories and proteins to be given. One third of calories and half of protein. Very important repeat question. We have to formulate midday meal in such a way that this quality is maintained. Half of protein and one third of calories. Age group class 1 to 8, that is 6 to 14 years. Remember the calories to be given in primary school children and upper primary school children. The energy part and the protein part. Don't confuse this table with Anganwadi table. That is totally different and this is totally different. Anganwadi Center, ICDS, Ministry of Women and Child Development, midday meal scheme. See the logo what they will be showing. It is under Ministry of Education. Ministry of Education. Good. Nowadays in midday meal we are extending it to pre-primary levels also. One nutrition expert will be there in one school to monitor their BMI and also hemoglobin levels, and nutrition gardens will also be established in schools to promote sustainability. These are very important recent updates related to midday meal, renamed as Pradhan Mantri Poshan Shakti Nirman. Good. Muskan scheme. Muskan scheme is to give proper child friendly services in government hospitals. It is to promote quality and give child friendly healthy services in government hospitals. Come to the next alphabet N. Nischay is your favorite pregnancy testing kits at sub centers, along with that with ASHA workers also. Free of cost, detecting pregnancies. Nischay, determination of pregnancy. Don't confuse Nischay with Nikshay. Nikshay is a website for notification of tuberculosis, where TB is a notifiable disease in India, and monthly reports we are entering into Nikshay. That report what we are entering will be going to district TB officer. Through website we are notifying. This is Nikshay, website for TB notification. Navjat Shishu Suraksha Karyakram is to train doctors and nurses for newborn care and resuscitation, not related to delivery practices. It is newborn care and resuscitation, and we are targeting mainly asphyxia, hypothermia, and infection. Related to this, we are targeting, and the training is given to reduce neonatal mortality. Good. NCD's 25 by 25 initiative important to reduce mortality related to non-communicable diseases like cardiovascular disease, cancer, diabetes, and chronic respiratory diseases. So CCC, like cardiovascular disease, cancer, chronic respiratory disease, and diabetes by 2025. So 25% relative reduction in the mortality to be achieved by 2025. It is one of the target under non-communicable disease global action plan. Open vial policy, like once we mention date and time on the vial, that opened vial can be used in the subsequent session for 4 weeks to reduce vaccine wastage. If the VVM is intact and expiry date has not passed, we can use such vials if the date and time is mentioned. It is not applicable for BCG, measles, JE, Rota, and Covishield Covaxin. These things cannot be used in the next session. DPT and the remaining vaccines can be used. Just remember, not applicable to. Baki remaining it is applicable. Only to remember both sides. Remember, not applicable to. So which cannot be used in the next session. Pradhan Mantri Surakshit Matritva Abhiyan clinics, PMSMA clinics. These are antenatal clinics on 9th of every month. 9th of every month, where the pregnant will come from the periphery, getting herself checked in all the government hospitals and selected private hospitals. We do these clinics right from primary health centers and above, not in sub center. So once the pregnant is coming, the stickers will be given denoting the condition: green, red. Green no risk factor, red high risk pregnancy. Blue is very important, Pregnancy induced hypertension. B for blood pressure, B for pregnancy induced hypertension. Remember like that. B for blood pressure, B for blue sticker, blue sticker. Yellow sticker is for comorbid condition, comorbid conditions like diabetes, hypothyroidism and PIDs. Repeat, green, red traffic signal. Then comes blue and yellow. Polio, P for polio. One more important update what you should know is Polio Free India, March 2014, where polio elimination certificate has been given. Total 5 out of 6 WHO regions have eliminated polio, and East Mediterranean region of WHO is still polio endemic. The two countries within this region which is polio endemic is Pakistan and Afghanistan. Out of wild polio virus 1, 2, 3, 2 and 3 have been eradicated. Wild polio virus 1 cases we are having in Pakistan and Afghanistan. It is not eradicated. Polio vaccine what we are using, OPV, can cause side effects like VDPVs and VAP. VDPVs, how many types? 3. CIA. C VDPV is the most common type due to mutation in type 2 component. So we are removing type 2 component in the vaccine, that is called as switch. Trivalent has been replaced completely by bivalent. Trivalent is 1, 2, 3, bivalent is 1, 3. Don't confuse vaccine derived poliovirus with VAP. VAP is totally different phenomenon. After the child who is immunocompromised receiving a live vaccine like OPV can cause paralysis in the same child due to immunocompromised state. Paralysis seen after 4 to 30 days. Mutation mainly in type 3 component, SABin 3 component, we are getting cases of VAP. VDPV is different, VAP is different. Prevention, don't use live vaccine. Prevention, don't use live vaccine. Live will be replaced completely by killed vaccine, that is called as shift. Switch is different, shift is different. Switch is change in the serotype, shift is complete change in the type of vaccine. Good. Pradhan Mantri Matru Vandana Yojana. It is under Ministry of Women and Child Development, where the pregnant is given, like the pregnant was given 5,000 rupees for first live birth. So 5,000 rupees for first live birth to promote nutrition. This is totally different scheme from JSY. Here it is Pradhan Mantri Matru Vandana Yojana to promote nutrition under Ministry of Women and Child Development. Pradhan Mantri Jan Arogya Yojana has been discussed already under Ayushman Bharat. One more from the alphabet P, what you should know is Poshan Scheme. See the full form, Prime Minister's overarching scheme for holistic nutrition. Prime Minister's overarching scheme for holistic nutrition, also known as National Nutrition Mission, which was implemented in 2017. The targets was supposed to be achieved by 2022. The targets related to four things. Sula is the mnemonic: stunting, underweight, low birth weight, and anemia. Sula is a brand of Indian made wine. If you don't know what is Sula, stunting, underweight, low birth weight, and anemia. Anemia has to be reduced by 3%, remaining all 2%. Remember like this, remaining all 2%. What is mission 25 by 2022 related to stunting? The prevalence has to come down by 20 or come to 25%. Come to 25% by the year 2022. Repeat my words. Now it is around 36% as of now. It has to come down to 25% by the year 2022, which could not be achieved. So mission 25 by 2022 is related to stunting. Rashtriya Kishore Swasthya Karyakram, from the alphabet R. Adolescent related scheme, where the objectives to target nutrition, promote adolescent reproductive and sexual health to reduce their sexual health issues, mental health to be promoted, important, violence we have to reduce, substance abuse we have to reduce, non-communicable disease we have to reduce. So remember, three things we have to promote, three things we have to reduce. Remember like this, total 3 by 3, total 6 things under Rashtriya Kishore Swasthya Karyakram. What are the things what they are doing under this scheme for adolescent? One is adolescent friendly health clinics, where we are targeting mainly adolescents, their health issues, especially sexual and reproductive health issues. Counseling purpose, we are using the peer educators, like we are targeting those friends, they will be trained properly related to adolescent health issues. Once we give training for them, they will go and counsel the remaining adolescents in the community. This is one approach, peer educator approach, friend counseling. Then only they will listen, because adolescent age we have to match the frequency. That is very important. Satya will be the peer educators under Rashtriya Kishore Swasthya Karyakram used for counseling. With separately I will teach in the alphabet W when I teach. This is weekly iron folic acid supplementation for school going adolescents. Total 7 C's what we need to target under RKSK. Once I have given the PDF for you, can read it later. It is just to head this, what are the components and how we have to target the adolescents, what are the coverage, content part, which communities to be involved, clinics, communication part, even counseling, and how to convert the other modalities into delivering the services. Rashtriya Bal Swasthya Karyakram. Don't confuse Rashtriya Kishore Swasthya Karyakram from Rashtriya Bal Swasthya Karyakram. It is for children, screening in the age birth to 18 years, from 0 to 18 years. 4 Ds important: defects, deficiencies, diseases, and developmental delays, including disability. Total around 30 conditions to be screened. The referral unit will be District Early Intervention Center. District Hospital will act as a referral unit under Rashtriya Bal Swasthya Karyakram. The screening level starting from birth at the hospitals, doctors and nurses will screen. From 2 days to 6 weeks, ASHA worker will be knowing. We have discussed home-based newborn care, house-to-house community level screening will be done. 6 weeks to 6 years, 6 to 18 years. Here it is Anganwadi center. The later age it is school, screened by mobile health teams where doctors will be there, one ANM will be there, and one pharmacist will be there. The conditions to be screened under Rashtriya Bal Swasthya Karyakram important. Total 30 plus conditions I told. In this, very important thing is nutritional deficiencies we have to remember properly, because all these are repeat question. थोड़ा सा मुश्किल है याद रखना, but yes, it has to be remembered. थोड़ा सा कोशिश करना पड़ेगा, because one question if it is corrected, like if the table it's given is asked and if you correct this question, very important, trump card, that extra edge what you are getting. Anemia, vitamin A, vitamin D, severe acute malnutrition, and goiter. Nutritional deficiencies you have to remember. And yes, we have discussed the alphabet. Satyas are peer educators under RKSK. Suvidha, biodegradable sanitary pads, don't confuse. Sparsh, leprosy awareness campaign. Sapna is a mascot under Sparsh campaign. Repeat, Satya, peer educators under RKSK, Suvidha, biodegradable sanitary pads, Sparsh, and Sapna. Sparsh is a campaign to create awareness in leprosy. We have discussed that part. And Sapna, what you are seeing, just an imaginary mascot in the posters what we are putting to send the messages to the community. If Sapna is telling something, community will listen. That is what the thought is, to give messages related to leprosy under Sparsh campaign. The mascot is Sapna. Suman's game. So you'll be having this alphabet, yes, which is very difficult. Satya, Suvita, Sparsh, Sapna, and Suman. Suman is related to maternal and child care to achieve zero deaths, newborn and maternal deaths. The strategies what we are having in Suman's scheme is, one is service guarantee charter, where the hospital will be displaying the services to be given in that facilities for maternal and child care. Free transport will be provided, and 100% maternal death reporting and reviews should be done, and grievance redressal mechanism. The full form is Surakshit Matritva Ashvasan. So the guarantee part is very important. Every hospital will display a service guarantee charter, like this is the menu to be given in the hospital. And once the pregnant is coming, if the service is not given, feedback mechanisms will be given, call center number will be given, they can register the complaints. It is making sure that the facilities will reach the pregnant. Suman scheme. SANS, it is related to pneumonia. We can know SANS as breath. So to reduce deaths in pneumonia, the full form, social awareness and action to neutralize pneumonia successfully. So we are creating awareness on the community level and So at the hospital level, early identification and referral is very very important in order to prevent deaths due to pneumonia. Sustainable development goals, total 17 goals, 169 targets. Repeat, 17 goals, 169 targets. Goal 3 is good health and well-being, directly related to health, good health and well-being. The targets to be achieved by 2030, the baseline level is 2015. So what is the baseline? 2015. Targets to be achieved by 2030. Sir, do I need to remember all the targets under goal 3? Not possible for you, so I'm giving the important targets only. MMR to less than 70 for 1 lakh live births, neonatal mortality rate 12, under 5 mortality rate 25. Target ATM, that is AIDS, tuberculosis, malaria. We have to end the epidemics. Reduce by one third the premature mortality related to non-communicable diseases. Reduce by half deaths related to road traffic accidents. All these targets was to be achieved by 2030. The only target by 2020 is road traffic accident related mortality. It should come down by 50%, should come down by 50%. Sabla scheme is related to vocational skill education and supplementary nutrition in Anganwadi centers, mainly for adolescent girls. It is empowerment of adolescent girls under Ministry of Women and Child Development, where vocational skill education is also given. Sabla empowerment, also known as Rajiv Gandhi scheme for empowerment of adolescent girls. Before there was KSY, Kishori Shakti Yojana, that is not existing now. What we have is Sabla, Rajiv Gandhi scheme for empowerment of adolescent girls. Suraksha clinics deals with STIs. So the kids, total 7 kids. S for Suraksha, S for STI, S for 7. Gray, green, white, blue. Remember, gray for discharge, green is for vaginal discharge, white and blue both for non-herpetic ulcers. Blue if the patient is allergic to penicillin. Red, herpetic ulcers. Kits 6 and 7. Yellow for lower abdominal pain, and B is for black, inguinal buboes black. So we have a mnemonic to remember this. Go green with blue rivers and yellow birds. You can remember the mnemonic. Go green with blue rivers and yellow birds. Gray, green, white, blue, red, yellow and black. Red, yellow and black. It's like in the imaginary thing. You're going to any trip, staying there, picnic spot, go green with blue rivers and yellow birds. TBT, National TB Elimination Program updates. You should know mainly what are the important things which has been repeated in the exam. Diagnostic part, everyone should undergo either CBNAT or TrueNAT for diagnostic part. Now we have to detect TB and the resistance at the same point. If the patient is sensitive to tuberculosis, 6 months of treatment, 2 months intensive phase HRZE, 4 months of continuation phase HRE. Total 5 weight bands are available. So the patient will get treatment according to their body weight. Adults 5 weight bands. MDR means resistance to 2 drugs, H and R. Along with this, one addition, fluoroquinolone, patient is labeled as pre-XDR. Along with pre-XDR, one more addition if you are doing either bedaquiline or linezolid or both, then we label the patient as XDR. Repeat, 2 drugs MDR, 3 drugs pre-XDR, next 4 or 5 because or both karke aayega na. So addition, it's like this: 2 drugs MDR, one more extra pre-XDR, one more extra, it is XDR. This is the sequence to be remembered. Definition is asked. Treatment thoda sa mushkil hai. If you can remember, it might be taught in respiratory medicine for you. HIV, tuberculosis, always keep in mind the most common opportunistic infection in HIV all over India and world, it is tuberculosis. How to diagnose TB? CBNAT in HIV patients. Don't do sputum and X-ray. Everyone we are doing CBNAT only or TrueNAT. Start ATT and then ERT. If the patient was having HIV TB together, start TB treatment first. After a gap of 2 weeks, add ERT, not together. In order to prevent the reactivation of latent infection of TB, we are using preventive therapy, either 6 months of isoniazid or 3-month weekly INH and rifampicin combination. Active case finding in slums and tribal areas, especially important, underline the word tribal areas, active case finding of TB. NICSHI's website, we have discussed that. Mandatory notification through NICSHI, yes, 1000 per patient is given for the notifier. If I am notifying, we will be getting 1000 rupees per patient. And the IPC section 269 to 70 is important. If I don't notify a case of tuberculosis, I will be punishable, like it is a punishable offense under which section? IPC 269 and 270. What the patient will get after notification? 500 per month during treatment to promote nutrition. This is Nikshay Poshan Yojana. 99 dots. You can keep an hidden number beneath the blister packs. The patient is giving missed call. That will tell whether the patient is taking treatment properly or not, to monitor adherence to drugs or treatment. That is 99 dots. National TB strategic plan. So what I have to remember? Targets 80% reduction in incidence of TB, 90% reduction in mortality. So it is 80, 90. Then 0. Patient should be affected by the cost factor. Nobody should be affected by the cost factor related to treatment of or even diagnosis of TB. These targets has to be achieved by which year? If they ask, it is 2025. 2025. Good. Then don't confuse with three things. Ujala, Pradhan Mantri Ujjwala Yojana. Ujala is LEDs, energy efficient, under the Ministry of Power, which is given at affordable prices, not free of cost. Pradhan Mantri Ujjwala Yojana is LPG connection for BPL families under Ministry of Petroleum and Natural Gas. Ujjwala scheme is to reduce trafficking of women and children. What are the components of Ujjwala scheme? Repeat question, always repeated. Prevention. Then comes R. Rescue, rehab, reintegrate into the family, and repatriation to the country of origin. Repatriation to the country of origin. U for Umeed. One more new initiative targeting inherited and genetic disorders. Unique methods for management and treatment of ID. The last two letter ID is related to inherited genetic disorders. What they are doing in most of the setups, they are promoting Nidhan Kendras. These are diagnostic facilities for genetic disorders where prenatal testing will be done and the diagnostic part will be taken care. Most of the times in the government hospitals, you'll be knowing in the government hospital, especially we neglect such inherited genetic disorders. To target that diagnostic part and whatever we can do related to genetic disorders, if this is the question, answer is Umeed initiative. U for Umeed initiative. Come to the last scheme from the alphabet W. It is weekly iron folic acid supplementation scheme as a part of Anemia Mukt Bharat, targeting school going adolescent, within school both girls and boys, out of school only girls, through Anganwadi centers. What they are doing in VIVS, you can see here, it is the blue tablets what we are giving. Blue tablets what we are giving. The dose is 6500, not 100. It is 6500 now. Good. Then it is weekly once. Yes, correct. Screening will be done for moderate and severe anemia. Moderate and severe anemia, not mild anemia. Biannual deworming using albendazole once in 6 months, and dietary counseling. So these are four components. Repeat: weekly once blue IFA tablets, moderate and severe anemia, good, biannual deworming, and dietary counseling. This is WIF's weekly iron folic acid supplementation scheme, targeting mainly the adolescent part under Anemia Mukt Bharat. What is the dose? 6500. Frequency weekly once. Color blue color tablets. So we have finished A to Z terms related to alphabet part. The last part which I should mention is the recent data, and in this remember MMR, neonatal mortality rate, and infant mortality rate. Sir, can I remember everything? Yes, you can, but at times you'll forget also. I know that. That is why I'm giving things which are important for you, not overburdening with everything. Not possible, because PSM is not the only subject, and updates is not the only topic in PSM. Got my point? And within updates, recent data is not the only. So it's not like only, but still, whatever you can remember, try to note it down and try to recall in the exam. You can and you should remember MMR recent value if it is possible. Yes, you can remember. I know this 97 less than 100 part we have achieved that. Neonatal mortality rate 20 and infant mortality rate 28. If you can remember this much, at least in the recent data part, I will be very happy. If you can remember crude birth rate, crude death rate, total fertility rate important, and if possible couple protection rate, I will be double happy. If you remember this much, one smiley. If you remember both, two smileys. And if I remember everything and if you recall everything, I'll be very happy and I'll be full of smiles. When you feel like quitting something, remember always why you started. What was your starting point, and where are you now? Where are you now means don't want any comparison with respect to others. It is within you. You are the only competitor. You always do things for yourself. Keep this in mind. Don't compare with the outer world. Just keep on maturing day by day, one by one, one by one, one by one. What were you the day before? And what are you now? That is what is important for me. And this video where I'm summarized all the updates in A to Z mode, keeping the most important things. I don't want you to overburden with everything. There are so many things to remember, but at least you have to remember this much. If you can reproduce 85 to 90% in this part or in this PDF, I'll be very happy. Again, I'm telling, I don't want you to recall 100%. Not possible at your level, because PSM is not the only subjects. There are 19 subjects, and updates is not the only topic. There are so many other topics. But still, keeping the updates in alphabet mode is what is my purpose always. Every year I'll be doing this. A to Z 2022 was the last year. A to Z 2023 will be this year update. And any doubt related to PDFs or any doubt in this, you can follow my Instagram page. I've given my Instagram handle with my same name, Rajiv Shetty. The user ID will be something like 54 something. If you can search Instagram Rajiv Shetty, you'll be getting, and you'll be getting all the links related to PDFs. Still, if you are asking me, sir, give me your number, I want you to WhatsApp something related to my subject, you can take my number also. 9971916548. Yes, good. So we have discussed so many things this year, like IBQs we have done, PYQs we have done, and we have given the flashcard part also, and this A to Z updates also, one shot PSM also we have done. So we have tried our level best from our side to make this subject something easier compared to what was it before. So PSM should be the trump card for you, should be the game changer for you in the exam, because this subject is very very important. And if you can recall around 85 to 90% of the questions properly, that can make a difference always. That can make a difference always. So all the best wishes. So all the best. I'm writing this again in the card so that it register on your mind. So best wishes, one smiley from my side, as I usually give for everyone all the times. Good. Thank you so much. Any doubt, you can use this Instagram handle or WhatsApp number to inbox me. Again, best wishes for your exams. So after the exams, fine, nothing to worry. You've done your best. Just don't take too much of stress. You have this confidence that you have done something in most of the subjects. Just go and recall. Just express yourself in the game. So don't take any undue pressure or undue stress. Go and play your shots. If it is offside, cover drive, square drive, leg side, flick, pull, hook, or even you can use that Surya Kumar Yadav shot also, Dil Scoop, na? SKY, Sky Shots. So all the best wishes. Thank you so much. Thank you so much.